Dr. Scott, throughout March and April of 2020, the Rhode Island Department of Health COVID dashboard featured two model estimates which claimed during that period, between April 27th to May 3rd, the peak daily census for COVID-19 hospitalized inpatients in Rhode Island would reach somewhere between 2,200 and 4,300 patients. The actual peak census for inpatients during this first wave was 375. Effectively overstating the potential damage sixfold to 11-fold than these models. Who specifically at Rideau and Brown University is responsible for these models, and are any of these individuals currently tasked with modeling? And of course, the question every week, when will it be appropriate to unmask and fully reopen the state?
The purpose of modeling is to project out what could happen if you do not put in place the interventions needed to prevent that from happening. So each time we are assessing the models, the goal is to help ensure that we never reach what is actually projected. So
what is then, is there a math component to say the worst case scenario, or are we going to continue to be fed data which induces fear, panic, and quite frankly, the after effect of cynicism?
If you notice, we do not share the models on a regular basis as using that as a driver. It's a piece of information that helps inform the types of interventions that have been in place. And each time we have updated it, it has been so that we can make any decisions necessary to help prevent that from happening. And I would say that has been done quite effectively. In terms of your second question, we are going to continue with masking and continuing to remain vigilant given what has been shared with the variant that's in place. And as we go forward, we will make adjustments.
One follow-up question. There are multiple credible reports of what I'll call obscene living conditions in the ACI, in the Cranston facility. A current prisoner, amongst many, cites the absence of mental health, prescription medicine. That shortage is blamed by the ACI on the pandemic. There's commingling of infected and COVID-free inmates. And I'll quote, an environment that has filth, mice and roaches roam the prison, scavenging for any type of food, human bodily fluids left on the walls of the cells, leaking toilets, fluids dripping, mold in the walls. Additionally, just 2 months ago, there was an inmate who passed for still unknown circumstances, and Mr. Jose Franco passed on February 9th. The inmate's family has still yet to be notified of the cause of death. My question is, how often does the Department of Health and their representatives inspect the ACI? What, if any, oversight does the Department of Health have over the Department of Corrections with regard to the basic safety of inmates and their constitutional guarantees not to be subject to cruel and unusual punishment?
That is a question that is separate from COVID, is definitely a story that is of concern and one that we will continue to evaluate, or will certainly look into and evaluate, knowing that corrections also would want to make sure that the right setting is in place for their inmates.
To do with COVID. I mean, if they're being not given their medicine because, and the ACI, which is a state function, is claiming it's because of the
get on to other questions that other people want to ask. You're dominating the early stages.
Okay, don't answer the
question. Make sure everybody gets a chance.
Doctor, I noticed you did not use countries of origin when describing the variants. Is that going to be the way that the Department of Health presents variants going forward? And would you like to see the media reflect that when describing variants?
We definitely like to focus on the scientific terminology that we are associating the variants with. We do understand that people have connected the B117 variant with that being the UK variant, for example. We certainly encourage and want the media and the public to be informed of the scientific term for it as well.
Will we see Brazil, other names like this, on DOH documents going forward?
If we need to, so the people have an association, but we want to make sure people are also familiar with the scientific form of the variant.
Yep, Dr. Alexander Scott and Tom McCarthy. Next week's allocation of the Johnson & Johnson vaccine, that's still coming in full, correct?
Correct.
Okay, and then how is that going to change moving forward? What were we supposed to get in our next shipment and when, and how has that changed at all?
What we have thus far is that the 16,000 doses of Johnson & Johnson vaccine coming to Rhode Island next week will not be affected by the manufacturing issue that was in the news last night. It is possible that this could affect our numbers in future weeks. I was actually just on the phone with our national colleague leading the vaccine rollout prior to this press conference, and they are doing everything they can to help ensure that ultimately the doses balance out, certainly by early May or so. We expect about 6,000 doses of J&J the week after next, which is a decrease from the 16,000, but we are anticipating that there will be some updated information, hopefully prior to that.
Do you think this will impact the state's timeline at all about having 70% of the population vaccinated by early July or so?
With a huge credit to the team, as Tom has mentioned, we are able to make the adjustments needed to continue with our anticipated timeline. And given the conversation that I just shared as well, the federal government is also looking to balance it out for all states as well.
Meaning boosting the Pfizer and Moderna shipments to Rhode Island.
And working on addressing the J&J as well.
Patrick and Brian.
I was going to ask about that exact thing. Are there, with travel expected over this weekend being a holiday weekend, are any different recommendations on whether folks should travel across states? You have many states, especially in the Northeast, that are having pretty decent upticks. Is there any guidance on whether people should travel out of state and back, with that being the case?
Yeah, we really want to make sure people are informed with the prevention measures that we know work. Mask wearing, getting tested before, after, and during, getting vaccinated once you are eligible. Our travel guidelines currently caution against traveling to places that have higher rates, particularly beyond 5% positivity. So making sure that you are also informed and educated about where you're going so that there can be another level of vigilance applied to keeping you and your household protected and safe is our current approach.
Can you change those quarantine rules?
As of now, no. We're continuing to assess.
Governor, I've heard some increasing frustration from school leaders that there hasn't been guidance on prom and graduation events, especially I know as Secretary Pryor has mentioned, they're loosening up the numbers on catered events. When will that be coming? They have to make plans if they want to book something. You know, can they have a spaced out graduation on the football field? Or if a wedding can have 200 people outside, can schools have a prom outside with testing and certain things like that?
I'd expect the updates to be coming next week on those issues. The commissioner will be here, as I mentioned earlier. We are discussing those issues right now, and it's a good opportunity to just everybody stay disciplined. The more disciplined we are, the more flexibility we'll be able to provide.
Do some of those things sound logical, though, if people are spaced out and there's testing ahead of time? Or?
Yes, I think they do. But again, we're going to make sure we're keeping track of what the infection rates look like and the hospitalization rates, which gratefully are down. And you're going to see more flexibility. We just got to make sure that we keep the flexibility, people disciplined. Thank you.
Scott, if I could ask you a question. I've heard that there was a loosening of restriction on nursing homes. Are residents allowed to leave and come back now? Have you heard anything about that? Like if they want to leave the facility with families and come back?
We have worked on ways to ensure that visitation is allowed for families without the types of restrictions that were in place before. If nursing homes are using that as a way to allow for some flexibility for their residents, we can support them in doing that safely as well.
I know most of the residents have been vaccinated, and I'm sure most families would welcome that as good news that they can see their relatives more. What about people who are concerned that even though many of them have been vaccinated, you could still bring the virus in and out with more visitations, or if people are leaving the facility?
It's exactly why we want to continue to maintain screening and promote the importance of testing, talk about the fact that masks work, and make sure that people are continuing to remain vigilant with this community.
Governor, yesterday that was a nice ceremony, and Council President Matos seems like an excellent choice for that position. When the Pawsox left Rhode Island, you know, we saw a real contrast where they complained that they had to go, you know, meet with Governor Mundo and the Senate President and the Speaker. Yet when they announced in Worcester, Governor Baker mentioned the Lieutenant Governor had acted as the point person. Are you thinking in terms of that almost transforming the way we operate government, where the should be confirmed Lieutenant Governor would almost act as your point person?
Yeah, and I think that Sabina is going to be very, very talented and skilled, so we plan to use her. But also, it's a great opportunity to show why we should be running as a team and managing it as a team. And I've been on record that should happen, and we're going to prove the case of the people of Rhode Island. We're going to insist that happens.
Can you also just, the number of people contacting your office on the climate bill that you wrote a letter, you had some concerns. Can you touch on that, and did that have any impact of business people or others reaching out to you on this proposed climate bill?
So I think that the position we took on that is that I do support the idea, obviously, of a safe environment and clean air. So, and I think that the technology that's going to be coming, I've always said publicly we should be riding that bumper on the technology as fast as it goes. It's going to go very fast, especially what the President is doing right now. My caution on there is that we've opened up is how hard as you might work to make that happen in terms of the goals. That we've opened it up that lawsuits can be filed by virtually anyone, and then attorney's fees would be covered with a very low threshold in terms of, you know, showing that it was a legitimate lawsuit. So what we're suggesting is that the General Assembly take a look and they empower the Attorney General to actually be the representative for the people, as the Attorney General does in many cases. So it's the risk for the taxpayers that I see in there in terms of frivolous or even lawsuits that are, you know, going to be potentially very costly to the state. The Attorney General is certainly in a position to do that.
For Dr. Alexander Scott, on some measures, we're doing extremely well in Rhode Island. I think we're about the 5th best or 6th best state on vaccination per 100,000. But on other measures, we're doing not so well. So we're about, I think, the 5th or 6th worst state on new infections per 100,000 on a 7-day basis. And that's, as noted, I think, getting worse week to week over the last few weeks. Not terribly worse. It's a plateau, I think you described, with a slightly upward slope. Why do you think we are seeing that increase in cases and new infections? Why do you think that Rhode Island is experiencing a worse situation than other states? And what, other than, you know, the obvious public health message, such as masking, distancing, and so on, do you see as potentially fixing that or changing that or improving that? And finally, do you see that as going to make it necessary to pull back on some of the reopenings and capacity limits that we've changed?
Thank you. So one of the elements that you are calling out is the fact that we are leading the nation in testing. We have among the highest rates of states with percent positivity, but also have a high case rate. That has been consistent all along, and the specific component to the case rate takes into account the density of our state, the ability to spread more quickly when there is a variance because of that density, and the overall size of our state, among other factors. It is why we specifically focus on our percent positivity to really balance out the fact that cases are ranked in a particular way compared to other states that may not be as dense, but our percent positive is among the lowest of states across the country in that 2% range. That being said, we have also had a slight increase, as I've shared, in our percent positives. It's still very slight, but enough for us to pay attention to and to continue to express vigilance and raise awareness about the variants being present and being more transmissible. In terms of how to handle the fact that cases have increased, our team altogether have continued to do very detailed analyses, understanding by municipality, by population group, by sector, what is contributing to those changes. We definitely know that we are reopening more. We definitely know that people are tired and are, may be letting their guard down, which is why it's always important to engage all of you as ambassadors to really spread the word about being vigilant. And we know that the variant is continuing to spread and will be the dominant strain at some point early in April. So those are very understood reasons for increasing in terms of cases, but we are balancing it with having among the strongest rates of vaccine administration in the country, as well as the focus on testing, which we have maintained while other states have trickled down in terms of testing, and the focus on treatment.
Let's go to Amanda, Anita, Ben, and then Steve.
Thank you. When it comes to the Providence vaccine eligibility, can we expect any more zip codes to be added to that list?
Expect any more?
Eligibility list?
As part of our high-density community and communities of color strategy, Tier 1, we have really focused on for improving our vaccination rates. There are still some more zip codes, particularly in Providence, that we need to see improvement on. In moving into Tier 2, which are those secondary groups that are impacted, we are looking at expanding into Woonsocket and later on into the month of April, considering further zip codes, one of which is also in Providence as well.
Anita.
Dr. Cole, Dr. Scott, or Mr. McCarthy, will appointments continue to be made available on Tuesdays and Fridays, especially as the next group is available to be eligible on a Monday, I believe, and especially as we're going to be seeing it open up to everybody in a couple weeks?
That's correct. They will continue to be available Tuesdays and Fridays for the mass vaccination sites, but our pharmacy partners, other vaccination partners, they release throughout the week.
The eligibility criteria at retail pharmacies will change midnight on Monday or later in the morning?
It will change, so first thing in the morning on Monday, so midnight, Sunday night going into Monday. They'll be eligible on Monday.
Ben and then Steve.
I don't know if this is for the governor or for the doctor. Earlier this week there was a scathing report that came out of Massachusetts about their DCF and the death of a child where the workers weren't able to get into the home because of the COVID protocols and everything. My question is Rhode Island DCYF, how close are they to getting back to in-home inspections, actually going into the home of children who have been either recently reunited or there's cause for concern? Obviously, the beginning it all had to get shut down, but are we getting closer to that point to actually getting the inspector physically in the home to inspect?
We have worked closely with DCYF to ensure that when they need to, in particularly urgent situations throughout this pandemic, that they are able to get into the home, have the proper support for doing so, and ensure that families are kept as safe as possible.
Governor, do you anticipate keying into these community connections program that the White House is talking about to try to overcome reluctance on the part of some people in the community to getting the vaccine?
Well, I think we're doing that already, Steve, right? So, we've activated our local communities and all the civic leaders and municipal leaders to do just that. And so I would expect that's going to continue. I think that community leaders, if that's what you're referring to make sure that everybody is aware that the getting vaccinated is keeping them safe and keeping them healthy. So, but I would say to continue to do that. We have been talking to the White House about the various hesitancy issues, and we're going to, take whatever resources that are available. But our municipalities and our community leaders are going to play a significant role, just like Dr. Alexander Scott said. we met with community leaders in the clergy as well as the Black and Hispanic community last week, and you saw how quickly we've been able to react to that, to that differential that we need to catch up on.
Governor, on the hesitancy issue, Health and Human Services Secretary Wamsetta Jones said at an event the other day that it's not about hesitancy but about access. And one of the things she pointed to was perhaps some people are not comfortable going to these mass vaccination sites where there are National Guard members in uniform with guns and stuff like that. What do you say to that? And I know there's all different kinds of clinics now for people to go to, but what's your response to that it's not as much about hesitancy as it is about access?
Well, first of all our sites are safe, so I want to let people know that they're safe. They should feel very comfortable doing that. And anybody has any objections to that, let us know. But the people are going into these sites are being really welcomed, and they should feel welcome coming in. But to the point that, as came up last week, the issue is the differential between in the Black community, Hispanic community. There is a difference right now in terms of the percentage, and we've just activated a plan to make everybody feel comfortable. Yesterday, the diversity committee that has been working for several months actually visited the Dunkin' Donuts site, and I think they're going to come out of there with a good information for their communities that this is safe. And so I think it's outreach. I think that it's it's actually education, and then we're going to have a great deal of work to do as we get past the goals we're setting for early June. There's going to be many, many people that we're going to have to continue to reach out to make sure that they're going to get vaccinated.
Is there any thought to kind of tampering down the militarized look of some of the sites, or potentially foregoing a registration system and just letting people show up at some point to knock down a barrier in that sense?
Yeah, I think that if we, like I said, the people who visited yesterday, I think they saw a really good, reach out to them and see what they thought in terms of those issues. I think that is an education that is safe, and people should feel comfortable using those. And if there's any areas that people feel as though that, there's too much, I guess, a sense of force or whatever you're referring to, they should let us know, because we'll certainly reach out to them and make them feel comfortable. The people who are actually at these sites, whether it's municipal pods or state sites, are doing extraordinary work, as well as FEMA is right now partnering in at the Dunk Center. So, yeah, I think that it's a communication, it's information, it's education. I think that most people will be very comfortable once they actually get involved. But we should be going out and extending our reach into communities as we get more supply, and it makes sense to do that. We're open to any way that we can get shots in the arms.
Last two questions, John Patrick.
Governor, do you plan to attend Mass in person, or are you going to just watch it virtually?
Well, last year we didn't attend. We did virtual. I would think that I'll be attending Mass this week, but we welcome, everybody should be celebrating their services the way they feel as though they should. And as Dr. Alexander Scott said, virtual is the recommendation. So I guess it hasn't been decided yet in my family. I'll have to talk to my wife, Susan.
How was the reaction yesterday making the rounds with your choice for Lieutenant Governor?
I think it's very positive, and the reception we got in Johnston with Mayor Policina was, to show that Sabina is a municipal leader as well. All the 39 plaques are going to stay on the walls in the office that we have, and we're going to make sure that we're in every community with the Lieutenant Governor over her first 100 days in office to make sure everybody knows that the communities are very important. So very positive right now, and I think it's going to continue that way. As my mom always said, the proof's in the pudding, and we'll actually demonstrate why we think it's very important to have a Lieutenant Governor and a Governor working very closely together.
And Doctor, last week, Governor Lamont in Connecticut blamed some of the spike there, which is, I think, even worse than here, on seasonality, on this early spring, late winter. It occurs to me this is when it was worse last year. How much do you attribute seasonality to the uptick?
It's actually a mixture, because some of the weather improvements are actually contributing to people going outside more, which is better in terms of decreasing the risk of transmission. It does not eliminate it, but we have been encouraging taking it outdoors, taking it outside, engaging in our economy and commerce in ways that we're able to support and doing that outdoors. The colder weather and drier climate is when you can have more risk of spread. So we'll just continue to walk the balance. We've only opened up to 75%. We wanted to stay cautious in many of our areas, but allow for some of that activity to occur. That may have been a little bit of the difference with Connecticut. And we'll continue to push on our vaccination administration rates and stay along pace or even beyond as they have done well also.